In this class, we are having revision for fetal circulation. So, what are the points we have discussed in our previous session for the fetal circulation? So, in fetus, the circulation or the purification of blood is taken place by the placenta of the mother. Through this, your fetal circulation or the blood should enter the heart, okay? Stop talking. So, the purified blood from the placenta of mother first passes through your left umbilical vein. This is the left umbilical vein. It enters your which part? It enters the liver. In liver we have portal vein. It has left branch and right branch. This is your portal vein. It has right branch and left branch. So now the left umbilical vein will join your left portal branch or left portal vein and through the inferior vena cava it enters your right atrium. This is your inferior vena cava. Okay, any doubts? Any doubts in this? The purified blood from the placenta of the purified blood from the placenta of the mother will enter your developing heart through the left umbilical vein. The left umbilical vein first joins along with the left branch of your portal vein and then it enters the right atrium through the inferior vena cava. Okay. Here we have two branches, but most of the blood that is coming from your left umbilical vein is entering into your left branch through a structure called which structure? Through a structure called ductus venosus. It's called ductus venosus. Okay. Now once it enters to your IVC, it has two options again. Either it can enter to your left atrium or right ventricle. Okay, it has two options, either it can enter like this or like this. Most of the blood which enters to your right atrium will pass to the left ventricle again through an important structure called foramen ovale. Okay. From the left atrium, it is going to enter the left ventricle. Once it enters the left ventricle, your purified blood is going to supply the developing brain and also the upper limbs. Brain and limbs, upper limbs. Is it clear for everyone? Any doubts? Any doubts in this? What is this structure called? this is aorta. Any doubts? Okay, fine. So now once the oxygenated blood enters to your developing brain and to the upper limbs, there is some amount of deoxygenated blood that's still present in your brain and upper limb part. Now that deoxygenated blood is going to return back to your right atrium. It is going to return to your right atrium. Okay. Once it enters the right atrium, it will directly go to your right ventricle. Now in the right ventricle we have a mixture of oxygenated blood and also deoxygenated blood. Is it clear for everyone? Now once the blood oxygenated and deoxygenated blood presents in the right ventricle, it is going to pass through a structure called what is this structure? This is your pulmonary trunk. This is your pulmonary trunk. So some amount of blood through a pulmonary trunk is going to enter the lungs. Is it clear? Any doubts? Okay. Once the deoxygenated or mixture of oxygenated and deoxygenated blood enters your lungs, remember your lung at this stage is non-functional. So it is only going to utilize the oxygenated blood required for its development. So again, whatever the deoxygenated blood is remaining is going to return back to your left atrium. Okay. Only some amount of blood entered your lungs. There is huge amount of blood still remains in the pulmonary trunk. Now that blood is going to push towards the aorta. Okay, through an important structure called ductus arteriosus. Ductus arteriosus. Okay. Now the blood which flows through the ductus arteriosus will return back to the placenta of the mother. And some amount of this blood will also go and supply to your developing lower limb. Is it clear for everyone? And this placenta of the mother will be supplied by now umbilical artery. This is all about the fetal circulation. Any doubts? Any doubts in this? Is it clear for everyone? Say yes or no. Yes? Okay, fine. These are the events that is happening before the birth, okay. There will be some changes after the birth. So what are all the changes we can see after the birth? If you clearly observe, in the fetal phase, the oxygenated blood is carried by vein and deoxygenated blood is carried by artery. But in adults, the oxygenated blood is carried by the arteries and deoxygenated blood is carried by the veins. So, there should be some changes that takes place after the birth. For that changes, the first thing, your umbilical artery should stop bringing the deoxygenated blood into your placenta of the mother. This should be closed. So, now after the birth, your umbilical artery is going to turn as a median umbilical ligament. Okay. And if there is no blood from the umbilical artery, there will be no flow in the umbilical vein also. This part will also close. So, later your umbilical vein is going to develop as a ligamentum teres. And also your ductus venosus, this part is going to develop as a ligamentum venosum. And the ductus arteriosus is going to develop as ligamentum arteriosus. Okay. And the foramen ovale is going to develop as fossa ovalis. These are the changes that takes place after the birth. After the birth, your umbilical artery will turn into median umbilical ligament and the umbilical vein will turn into ligamentum teres and the ductus venosus will turn into ligamentum venosum and the ductus arteriosus will going to develop as a ligamentum arteriosum. Foramen ovale will turn into fossa ovalis. Okay. Any doubts? You can see here now. The fetal circulation is different from that of the adult circulation. There are three basic reasons for this difference. Blood in the fetus is oxygenated by placenta and not by the lungs. During fetal life, the lungs are collapsed, hence the resistance to blood flow through the lung is much higher. As a result, only minimal amount of blood passes through the lungs to supply oxygen and nutrients to the lungs. Portal circulation is also of little significance in the fetal stage. We have placenta, it is the source of oxygenated blood since the is not the lung but the placenta here, and also it helps in the gaseous exchange. Next we have umbilical vein. Oxygenated blood from the placenta comes to the fetus through the left umbilical vein which later joins the left branch of the portal vein. A small amount of this blood passes through the substance of the liver to the inferior vena cava, but the greater part passes direct to the inferior vena cava through the ductus venosus. Ductus venosus, it is for bypassing the hepatic circulation. A sphincter mechanism in the ductus venosus controls the blood flow. Next we have foramen ovale. It connects your two atria. The oxygen rich blood reaching the right atrium through the inferior vena cava is directed by the valve of the inferior vena cava towards the foramen ovale. And here it is divided into two portions. Most of it passes through the foramen ovale into the left atrium. The rest of it get mixed up with the blood returning to the right atrium through the superior vena cava and it passes into your right ventricle. Next important structure is ductus arteriosus. It is a bypassing for the pulmonary circulation. From the right ventricle, the blood enters the pulmonary trunk. Only a small portion of this blood reaches the lung and passes through it to the left atrium. The greater part is short circuited by the ductus arteriosus into your aorta region. Blood supply to this fetus, we have seen that left atrium, this is blood supply from the two sources. The oxygenated blood from the right atrium and a small amount of deoxygenated blood from the lungs part. The blood in the left atrium therefore fairly rich in the oxygen. This blood passes into the left ventricle and then into the aorta. Some of this oxygen rich blood passes into the carotid and also to the subclavian artery to supply your brain, head and neck, and also to the developing upper limbs part. The rest of it get mixed up with poorly oxygenated blood from the ductus arteriosus. The parts of the body that are supplied by the branches of the aorta arising distal to this junction with the ductus arteriosus therefore receive blood with only moderate amount of oxygen. Next we have umbilical arteries. They carry deoxygenated blood from the fetus. Much of the blood of the aorta is carried by the umbilical artery to the placenta, where it is again oxygenated and returned to the heart. This is the picture which I have explained. You can take 2 minutes and revise the structures. If you have any doubts, you can discuss with me. Peculiarities of the fetal circulation. 3 times blood shunts along its course at ductus venosus, foramen ovale and ductus arteriosus. Remember, ductus venosus, foramen ovale and ductus arteriosus are very important points in the MCQs and also for the clinical problems. Ductus venosus, it directs blood to inferior vena cava by passing liver without losing oxygen content. Next we have foramen ovale. It equalize the distribution to each half of the heart and more oxygenated blood to the upper half of the vital organs or developing organs. The next structure is ductus arteriosus. It directs blood to placenta for oxygenation by passing the lungs. So this is the reason why the upper limbs have more larger in length compared to your lower limbs. Okay. More oxygenated blood will be supplied to your upper limbs. The length of the upper limb is more than the lower limb in the fetus. Next we have sphincteric action. At the junction of left umbilical vein and ductus venosus, it regulates oxygen content of inferior vena cava and excessive load on the heart. Next we have mixture of the oxygenated and deoxygenated blood. It takes place in the liver, terminal part of the inferior vena cava and both on the atria and distal part of the arch of aorta. Transseptal blood. What do you mean by transseptal blood? Okay, find out what is transseptal blood. Okay, transseptal blood flow throughout the fetal life through ostium primum and foramen ovale. So where we can see the ostium primum? Ostium primum. Changes in fetal circulation that occurs after the birth. At birth, the placenta, that is the fetal organ of respiration, is separated from newborn and lung starts oxygenating the blood, that is the respiration is established. Now the oxygenated blood comes to the heart from the lungs. As a result, the following changes takes place in the fetal circulation. Umbilical vein, as it no longer carries any blood from the placenta, it obliterates and forms a fibrous ligament called ligamentum teres hepatis. Ductus venosus, it will also obliterate to form a fibrous ligament called ligamentum venosum. As the lungs are inflated and the pulmonary circulation is established, pulmonary veins bring more blood to the left atrium. Now as the pressure of the blood in the left atrium is more than that in the right atrium, the septum primum, where we can see the septum primum and septum secundum or septum intermedium, where we can see those structure, septum primum, septum secundum and septum intermedium. Fine, I'll just end my class here. Okay, thank you.